One of the most common procedures that I perform in my office are dental crowns. Dental crowns are a tooth replacement for teeth that are heavily restored. Many patients come in with large restorations on their teeth, and they are susceptible to fracturing, which could actually make the tooth non-restorable. So what a dental crown is a patient comes in and we reduce tooth structure 360 degrees around the tooth, and we take an impression of that tooth preparation. We send that tooth preparation or that impression to a dental laboratory. A dental laboratory fabricates a porcelain or a metal ceramic crown and sends it back to my office. And your second appointment, which is normally 2 to 3 weeks later from the first appointment, we cement that crown in place. And the purpose of the crown is to make that tooth stronger, and a lot of times it will make the tooth more aesthetic as well.